when we think about the fears around the coronavirus pandemic right now, we've been tracking cases in a lot of the worrying states, but worth noting that it's not only those states that we should be looking at here, as fears of a resurgence in New York are also there. We saw that play out in California, having to shut down again. Cases in that state topping more than 600,000 there. And for more on this and the way that the nation is grappling with it on every front, joining us now is Dr. Arabia Mollette, emergency physician at the Brookdale Hospital Medical Center in Brooklyn, New York. And Dr. Mollette, I mean, first off, we've gotten a lot of updates on the vaccine front, but I just want to play you a sound clip that we've seen in terms of both President Trump and now Democratic nominee Joe Biden talking about masks, since we've heard the update from the CDC there, saying that this could probably be over in the next 4 to 6 weeks. Not over, but marginally improved if everyone wore masks. Just want to play you a little bit of the political divide we're hearing right now. Take a listen.
Every single American should be wearing a mask when they're outside for the next 3 months at a minimum. This is America. Be a patriot.
It's a shameful situation for anybody to try and score political points while we're working to save lives and defeat the pandemic.
All right, so Dr. Mollette, I mean, you heard both politicians speaking there. The CDC has said that the fall season will probably be the worst ever in the U.S. history for public health. So what's your take right now on how this is the time we should be preparing for the fall and how masks can play a role in that right now?
Well, first, I would like to say that we cannot put time on data or use data in a sense where we place in time when this coronavirus pandemic will cease. First of all, the numbers will continue to increase as long as the states do not shut down properly and do not mandate their citizens to wear masks. And that's the big problem. They haven't shut down properly in the first place, or haven't had restricted lockdowns, and they're not mandating their citizens to wear masks. Again, there's no timing when this pandemic is going to be over. So we're saying that 3 months at least, the minimum. I disagree with that. We just need to be wearing masks until we can find a cure or a safe, non-toxic vaccine to fight this pandemic.
Yeah, and the political divide is strange there too, since Trump's own CDC director, Robert Redfield, has talked about how masks do help. And then you hear the pushback from President Trump saying that Joe Biden is just scoring political points here for calling for a national mask mandate, saying that there's no way to enforce it. However, we know that governors can enforce it if they impose a mask mandate here. So I just don't really understand the discussions playing out right now on the masking front. But I'm not sure if there's any way to really explain it in a way that would prove why it's something that's so important right now.
To be honest with you, none of us understand. Those of us who are on the front lines, whether it was the former epicenter, which is New York. And remember, New York was hit the hardest back in March. From March to actually the end of April, or about mid to late April. And it did work. It helped brought our numbers down, not only just wearing masks, but we had the strictest lockdown in the entire country for approximately 15 weeks. And although it was hard initially for many New Yorkers, but New Yorkers had to pull in together to be able to bring our numbers down. And it wasn't just from the governmental side or the governmental level. It was almost every New Yorker had participated in bringing down our numbers and wearing masks, practicing physical distancing. We changed the term from social to physical distancing. And so I'm just not understanding what is the big deal of just promoting public health. Profits over public health has become a major issue in this country. When are we going to do away with that? I have no idea, but it cost so many lives of American citizens in this country and had devastated numerous communities throughout the United States.
And I mean, it's not to say you can't have both. I mean, we've seen it work in terms of wearing masks and having businesses reopen modified, albeit modified. But, we've seen outdoor eating resume here in New York. But I'm glad you mentioned what could happen here in New York, because there are a lot of fears that we would see a second wave, even though the case count has come down. Today, Governor Cuomo announcing that New York City museums will reopen starting next week with 25% occupancy. Bowling alleys coming back Monday with 50% occupancy. But we know that there are quarantine rules in effect here in New York to protect against that second resurgence. And I just want to read a little bit of a statement that we got from Governor Cuomo's office talking about right now whether or not New Yorkers are actually following quarantine procedure. And here's what they had to say. They said, quote, "Right now, overall, we have nearly 100% compliance because people who don't fill out the form get a summons and potentially a fine. We don't have data yet on how many people have not followed the quarantine, as this effort is done by the localities which ensure compliance through interviews, phone calls, daily text messages, and random checks." Now, anecdotally, I have seen some people not following these quarantine rules coming back from some states and traveling around and not staying inside. So what's your take right now on how much effort and how much force is actually there? Because I don't know if we should really believe 100% compliance based on what we've seen here, but what does it say about how some of these states, New York included, might not have the power to actually enforce these things?
Well, I think New York does have, well, I'm not going to say that we have the power to influence these things, but one thing I would like to say is that the reason why we are able to reopen New York through various phases is because that we had followed and met the government's criteria for returning to or reopening the economy. And those two phases that we experienced were a 14-day downward trajectory of confirmed cases or documented cases. And we were able to take care of patients without critical care. And that was a big, big part of why we are able to move in that direction. It is not to say that the research cannot happen again, because as we see what's happened in New Zealand a few days ago had 0 cases confirmed with coronavirus, but now they have a cluster and it actually increased to 14 cases. And now the country decided to go back into lockdown. So right now, there's no definitive answer. I think that we are going to do the right thing. I'm just speaking from New York, but the newer hotspots did not necessarily meet the criteria, first and foremost, did not have a complete lockdown. And children are now returning to schools in communities in which the virus spread is detrimental. And so this is the part that I'm really, really concerned about, because I just don't understand why can't we as a nation able to come together and put away our political differences, leave the politics out of it, and fight this pandemic.
That's something that I think a lot of us would hope to see. We're seeing more places go ahead and change their rules based off of the data coming in. We just saw Stanford go ahead and unfortunately let students know there that they might not be able to be invited back to campus because of what they're experiencing now. But Dr. Mollette, appreciate you joining us to share your insight there, emergency physician at the Brookdale Hospital Medical Center in Brooklyn, New York. Thanks again and good luck.
Thank you.